Good morning, afternoon, or evening, everyone, and welcome to today's workshop titled Empowering Communities: Innovative Approaches to AI, Health Research, and Engagement. My name is Bryain Maradiaga-Mendoza, and I'm part of the regional coordinators team specifically for the LAC region, the Latin American and Caribbean, in the Artificial Intelligence for Global Health Research Community of Practice. This workshop is brought to you by International Development Research Center funded AI for Global Health Research, MESH, and the Global Health Network at the University of Oxford. It's a pleasure to have you all here. I want to start by extending a special thank you to the funding partners at the IDRC and the Global Health Network, and all our distinguished speakers and panelists who have joined us today. Thank you. So the first day, when you register, you saw the event is going to happen in two occurrences. So this is the first day in which we're going to be delving into the understanding the community engagement, the foundations, in which we're going to be covering an overview, specifically of community engagement. And I just want to touch base upon the rationality behind this workshop. So IDRC, which is the funding partner based in Canada, funded this initiative, 5-year initiative, to explore the use of artificial intelligence-enabled solutions in different aspects of the health system, from public health monitoring to the end point of care services as well. So we know while AI can potentially improve the health outcomes of the population, it also brings important ethical, legal, and social implications as well. This should be managed and appropriately governed to avoid any risk to individuals and the population whatsoever as well. So despite the growing demand for health-focused AI solutions in the low and middle-income countries, there's a big lack of evidence from the low and middle-income countries-based researchers on how to strengthen health systems, improve health equity, support gender equality, and ensure a local supply of credible data as well. So this is the main gist of why to create this initiative. So we're a collaborative partner in the initiative in which we have been talking with the different partners in the Global South, and we have identified a pressing need to develop and deliver a series of workshops to bridge some knowledge gaps. And specifically, this one is going to be focused, as you all know, in community engagement, specifically in AI healthcare research. But this workshop is not only tailored for the AI researchers in healthcare, it's going to be tailored as well to build a capacity from the broader healthcare audience as well. So this workshop will cover a wide range of topics, including the challenges and opportunities involving community engagement and the best practices as well that could be adopted to ensure community engagement in research is done effectively. So by the end of the workshop, participants will be better equipped to engage with communities in order to have a better health outcome as well. So we can move on to the agenda. So my name is Dr. Bryain Maradiaga. I'm going to be the chair for this session. I'm the coordinator, as I said before, for AI for Global Health Project, specifically the Latin American and Caribbean based in Honduras. And we're going to be moving on to the topics. We have 3 great topics for you. The first one would be, we will begin with a conversation with Dr. Davies as he delves into the general overview of what is community engagement in global health research. With this, we will understand how to engage with the communities effectively, because it is crucial, as we know, for the success of any health initiative, particularly when we integrate advanced technologies like AI. Then we're going to be moving towards the exploration of health research ethics with artificial intelligence. It's going to be given by Dr. Colomé. This session will address any critical and ethical considerations as well, and challenges of implementing AI in health research, so we can ensure and maintain the trust and integrity in our work. And lastly, we're going to move to the end of today's session with an interactive talk with stakeholders mapping and analysis. This is going to be given by Luis Arias, and this discussion will shed some light on practical insights into identifying and analyzing the stakeholders as well, which we know is essential to effective community engagement and successful project implementation. So I encourage everyone to participate actively. As I said before, in the housekeeping rules, we have the Q&A and we have the chat as well enable for you to participate. So you can go ahead and ask any questions, share any perspective throughout the session as well. Your engagement, as we know, is going to be critical for this workshop to be as productive and enriching experience as we thought. So thank you for being here, and I look forward to an insightful discussion and meaningful exchanges with you as well. So the next one. Quickly, we're going to be covering the learning objectives for day one, which will be the participants will understand what is community engagement, the fundamental principles and importance in health research as well. Then we're going to be moving on to the second objective would be the participants will identify practical considerations and challenges in integrating artificial intelligence into the community engagement efforts. Participants will be able to effectively identify and prioritize critical stakeholders in health research projects, which is the main goal of this workshop, by utilizing what we are going to be teaching, which is the stakeholder mapping techniques, in order to develop a comprehensive strategy for engagement and collaboration as well. And the last objective would be to learn practical strategies for engaging communities in health research and the decision-making process. Next one, please. As you can see a map in which we can see the geographic location of the registrants for this workshop. We have had a total of over 1,400 registrants, which is a big number. And as you can see, we are covering a good amount of the countries, and specifically in the global south as well, which I think underscores the pressing need of this topic and the high interest in community engagement, which is something that we have identified from the different talks and conversations we have had with the experts in the past. So I think it's really important to highlight this registration mapping. Thank you. As you can see, the countries, we have Kenya, Nigeria, in the top two. So moving over, we're going to be talking about the first topic, which is an overview of what is community engagement in global health research. This topic is going to be given by Dr. Alun Davies. And meanwhile, he's going to be sharing his screen to give his presentation. I'm going to be talking a little bit about Dr. Davies. So Dr. Alun Davies is the leader of MESH, which is a community of practice within the Global Health Network in health research. He and his team of coordinators based in health research institutions across Africa, Asia, Latin America, and the Caribbean. They work towards strengthening practice through sharing skills, knowledge, and resources as well among engagement practitioners and researchers. Dr. Davies has a significant success in establishing a large-scale engagement program focused on science in Kenya, which started as a pilot scheme back in 2009. And now he has become a flagship element in the Kemmery Wellcome Research Program Public Health Department. So he, as you can see, is gaining international recognition. He also has an extensive experience leading engagement in multi-country projects, for example, in the Sub-Saharan Africa, the Southeast Asia, and South America. In addition, Dr. Davies led a WHO technical document group for good participatory practice for a multi-country COVID-19 vaccine trial. His PhD in public engagement evaluation utilized mixed methods and participatory approaches, including participatory videos to explore engagement, impacts, and outcomes and influences. So with that, I can leave the floor open to Dr. Davies. Thank you.
Thank you, Bryain. Can you hear me okay?
Yes, we can hear you.
Okay, good. Yeah, so as Bryain said, my name's Alun Davies. I currently lead the MESH platform, which is a community of practice and online hub for community engagement within the Global Health Network. So I've been working in community engagement for about 20 years now, and I've been used to starting presentations with engagement is increasingly recognized as important for global health research. But now, as you can see from this quote by Ted Ross of the WHO, community engagement is now considered to be the heart and soul of global health research, ensuring that our efforts are not only scientifically sound, but also socially relevant and culturally sensitive. So a nod there, not only to the contribution that community engagement can make to the rigor of science, but also a nod to how important it is for yes, social relevance and cultural sensitivity of research. So engagement is now demanded by funders, and that's not only as an engagement strategy that works alongside a research project, but it's also demanded upfront to inform the application form and to inform the proposal for engagement. There you see two, I've cut and pasted two phrases from the application forms of the NIHR funding application and the Wellcome Fellowship application. They both really demand engagement. So it's something that is really essential by now in order to gain funding to do any research, any global health research. So the work I'm going to present today is basically drawn from this course, which is a free online course that's hosted on MESH and the Global Health Network. It was co-funded by NIHR and MESH, and is freely available to everyone. So I guess given that, as far as I'm aware, there are no guidelines to for engagement with research in AI and health specifically. My talk and Lewis at the end, our talk will be based on basic principles of engagement and stakeholder engagement, which can be drawn upon for research in AI and health. So I guess the first thing that one might see if they're seeing community engagement for the first time is the plethora of terminology that surrounds this field of work. They vary from community dialogue, stakeholder engagement, GPP, PPI, engaged research, GPP, EP, good participatory practice, public engagement. There's a whole host. And there might be some slight differences between each of them, but they're all overlapping. And the terms are also a bit ambiguous. So if you take terms like community, public, stakeholder, engagement, and involvement, they're all contested terms with no universal definition. For example, if we asked, what's meant by community, it could be people living in a specific geographic area, it could be people from a specific religion, it could be from a specific ethnicity, or people with a common interest, like you see Liverpool football supporters here, or a community of people sharing health conditions. And I mean, this is often a community that's defined by researchers. And we have to bear in mind that people may not always want to be recognized as part of specific communities defined by researchers. And also another thing to be aware of is that people belong to several different communities at the same time. I guess what's important from an engagement point of view is that we are really clear about who we define the community when we are planning our strategies and implementing our work. The same is true for public. When we talk about engaging the public, do we mean the global population, the population of cities, countries, or continents? Do we mean people who use national health programs, people who listen to radios or watch TV, people in the streets, or voters or taxpayers? Again, we need to be very careful about how we define what we mean by the public. The same is true for stakeholders. And stakeholders can be local community representatives, NGO leaders, research institute director, the Minister of Health. The same about community groups from all those groups of people. And the important thing, again, is that when we are defining our strategy, when we're describing who we engage with, we need to be really careful who we describe as the community. So from the training course I mentioned early at the start of this presentation, there are three excuse me, definitions which might be useful. And these are working definitions from a research point of view. I should stress that these are not universal definitions, but they might be useful for you as you're thinking about who your stakeholders, who your community or your public might be. So stakeholders, according to this definition, are people who have an interest in or influence what research is done and how it's done. The community comprises the people who are affected by research, whether they take part in it or not. And they may also be stakeholders. And the public are a broader group of people which the community and stakeholders are part of, who may have a general interest in the research and its role in society. I say may have an interest, they also may not have an interest in the research. So now we've looked at who the audience might be. If we looked at these terms, what's meant by engagement and involvement? And again, these are contested terms with no universal definition. For example, NIHR in one of their websites describe involvement as an active partnership between patients, carers, members of the public with researchers that influences and shapes research. Whereas engagement, according to NIHR, is information and knowledge about research is provided and disseminated. So that's really different to what you might find in the community engagement literature. This is one definition of engagement, meaning inclusive participation that supports mutual respect of values, strategies, and actions for authentic partnership. So the difference between engagement over those two definitions are really different. So again, really important that we're specific about what we mean. But one thing is from the course's point of view and my point of view, there is a difference between engagement and communication, where communication might be thought of like reading a newspaper where information is going in one direction, whereas engagement implies more of a two-way conversation, a two-way communication, which implies talking as well as listening. Another thing that might be useful for you is this is called the spectrum of participation. And it was published by YAP2, and it's a scale of, well, a kind of, I guess, a mapping out of participation from information giving to consulting communities or consulting publics, or involving in decision making or collaborating with community members towards a joint research project, to the extreme end, which is empowering communities to conduct their own research. And I guess one thing to point out is that, well, in my view anyway, none of these are better than the other. And in an engagement strategy, you might take elements of each one of these as being important. So what is community engagement and involvement? Well, first of all, it's a range of terms. Secondly, it's a range of activities like community meetings, radio interviews, community advisory boards, meeting health teams and social media. So a range of activities, and also a range of goals, from raising public awareness, assessing acceptability, to fostering trust and collaborative partnerships. I'll talk more about these goals because they're very, very, very important if you're designing a strategy for community engagement. So you might think of engagement as what you might do before a study starts, or even in some cases before you submit your application for funding, or before you do anything with the research, you might want to engage the community to understand their norms and views, which might be useful to identify local health priorities which need research. You might want to promote an understanding of research so that you can facilitate community input into research design. Community engagement might be a good way of identifying and addressing ethical issues, but also, according to good participatory practice, which is a guideline for engagement with clinical trials, you would want to assess whether your research is acceptable by the community. And if the research is acceptable, then that tells you something about the feasibility of being able to recruit. So they may be activities, engagement activities that you might want to do at the beginning or before you even start doing research. During a piece of research, you might want to gain permission and community consent to do research. You might want to draw on community views to improve communications and consent materials. You might want to improve recruitment and retention rates and build relationships and trust with the community, or express respect to communities. At the end of a research project, it might be important to share research findings as part of a community engagement strategy towards ultimately improving healthcare. And engagement at the end of a study would be important to support young people, might be to take up research careers. So I guess the way that good participatory practice phrases this is that you might want to do engagement to provide community input into research, during the research to perhaps identify and solve challenges during the research, and after the research towards maintaining and building partnerships so that research can continue afterwards. So I talked a bit about the range of methods. How do you select methods? There's a range of methods, and this is by no means an exhaustive list. Community advisory boards are when groups of community representatives join regularly with researchers to talk about the research and to advise on how the research should be implemented. Patient advisory groups comprise of people with lived experience who might be able to give insights into how research can be designed and implemented. There may be lab open days where people can see how blood is stored, town hall villages for Q&A, radio and TV interviews, social media is increasingly being used, meetings with hospital management groups to advise on how clinics can be used for recruitment, for example, workshops with doctors and nurses, and also sometimes used large population surveys and focus group discussions so that you get an idea of how the general public might feel about aspects of research. Again, the type of research might dictate what type of activities you do, whether it's a community-based research, hospital-based research. Also, the type of goal might help you decide the type of engagement method that you would use. For example, a community-based research, you might have a community advisory board, lab open days, town hall meetings, or radio interviews. A hospital-based clinical trial, the engagement team might have a patient advisory group that meet maybe once every two or 3 months to advise on the study. There may be radio or TV interviews to give the public an idea of the research, meetings with hospital management groups or nurses. Or in order to get public or community input into study design, you might use these methods like community advisory boards or talk to hospital management groups. I mean, this is another way that's increasingly being used to describe the type of research or type of engagement activities. On the left-hand side, you have deep engagement methods, and they're about having smaller meetings with smaller numbers of people, but over a longer period of time, in order to foster relationships so that people can openly give their views into research. They're often more participatory, more opportunities for mutual learning because of that built up relationship, but there might be limited representative. In contrast to wider, more public-facing engagement, which are typically shorter encounters with greater outreach, perhaps they might be less participatory and more geared towards public awareness raising. So, for example, a social media posting towards recruitment might be considered a wide engagement activity. Community advisory boards that meet regularly would enable building up a relationship with community representatives and form more of a deep engagement activity. Similarly, with hospital management groups to foster that activity for joint decision making. Maybe laboratory open days and that kind of thing is short activities aimed at maybe community leaders or community members or schools. I guess the important thing is that a strong community engagement strategy would combine both wide and deep approaches so that you have methods of maybe creating awareness across a wider public, but also a means of drawing insights that can inform the research. So this is my last slide. So this course, this community engagement and involvement course was written by a group of authors, and it's been peer reviewed by engagement experts across the world, really, and it's free of charge. Yeah, so thank you very much. I'd be very happy to answer any questions.
Thank you, Dr. Davies, for this comprehensive topic. And we have some questions. We have many different questions, but for the sake of time, we can only answer a couple. And the rest of the questions could be answered directly in the Q&A chat, Dr. Davies. So whenever when we're done with responding to these two questions, you can go ahead and reply directly to the person who asked. So the first question would be, this one is more tailored towards AI, but I think you can cover it as a specific or broader term in research. So the first question is, what opportunities exist for the cross-sector partnerships to leverage artificial intelligence to address health disparities and promote community health equity? So I'm gonna repeat it again. What opportunities exist for cross-sector partnerships to leverage AI to address specifically health disparities and promote community health equity?
I think that's a great question. It's a really good question, but it's not a question that I can answer because it's so context specific. And I would suggest that one of the best ways of answering this question is that groups of people from specific areas who want to do this work, who want cross-sectorial collaboration, maybe should brainstorm together. Well, who are the stakeholders that need to be brought together to form this discussion, and how can this happen? I think that's a really important thing, that only the people who are placed in these areas are best placed to advise on who should be advising on this and how that can best be done. So sorry, I'm passing that one away.
No, that's fine. That's fine. I mean, that's why at the beginning I said that it could be specifically for AI, but definitely if you think about it, the question is asking which is some way in which we could actually sell something new to a certain population, and specifically talking about health disparities and to promote health community equity. So in that sense, I think what you suggested is the best answer. In the sense, you need to identify the stakeholders and then actually approach them specifically to cover their needs. And that is something that you need to recruit a specialist, and in this sense, a specialist in AI and in healthcare to actually identify the stakeholders. So that's a great answer. Thank you. And the second question is a big, interesting question, which is how can we secure funding for research on community interventions?
Yeah, I mean that's another good question. And again, you know, I'm not the best person to answer that question. Often, I think for big funders like like NIHR and Wellcome, is that they place such a value on engagement these days that they incorporate, you have to incorporate a budgetary allowance into your work. And so some of the big funders are beginning to insist that a proportion of that work is budgeted for engagement. I think there's still a gap for sourcing engagement or sourcing funding for engagement to feed into proposal building. And I think, you know, that's still a tough question. There's still a gap that needs to be answered. I think often what people have to do is depend on existing structures. For example, if a research institution has a community advisory board that's been set up for other research, then they may be piggybacked onto to draw insights on new proposal ideas. I think people, you know, have to be creative about how they do this engagement up front to feed into proposals. But you know, the more you do, the better it is, arguably.
Definitely. I agree with what you said. I think we have time for another question. So there's a big discussion around this one here in the Q&A. So the question is, how to measure and evaluate community engagement?
Yeah, okay. I mean, that's another tricky one because, you know, I'll tell you why it's challenging to engage, because you saw that slide that I presented with goals of engagement, and there was probably 15 goals listed there, 15 or so goals listed in that one slide. And the challenge is that in order to evaluate all of those, it's going to be very hard, especially since some of the goals can be contradictory or at tension with each other. For example, one goal of engagement might be to raise people's awareness of some of the risks involved in taking part in research, while another goal is to recruit people for research. And you could argue that one kind of pushes against the other, so they're kind of quite difficult to evaluate. But I think perhaps more importantly, rather than evaluating, you know, the differences in knowledge or differences in attitudinal changes that happen as a result of engagement, is documenting what are the impacts of engagement on trials or on pieces of research, and documenting how engagement has contributed to improving research, or, you know, what contribution has engagement made to a study, or to recruitment, or to improving communications materials. So I think it's an important aspect would be to look at the direct outcomes of engagement.
Amazing. Thank you. And I think we have a little bit of time still, so we can answer another question. So this question is from a anonymous attendee, in which he or she is asking if they would like to have more clarity between the sensitization activities and the engagement. It seems that some of the methods, such as social media, for example, would be more directed to provide information rather than involve in a two-way discussion. Is that correct?
Yes, I mean, I think that's true. I mean, it's if you look, that last slide I showed about, you know, some activities are definitely more about raising awareness and sensitizing people. I mean, I look at my Facebook page, look at my Facebook, and I see quite often the local universities posting, you know, opportunities to take part in research, and that's quite common, I think, now. And you know that there's no means for me to respond to that and say, hey, why don't you do it this way? You know, why you know, it's actually an advert, and I can sign up for it. So that really is sensitization. Of course, that doesn't mean that every social media is a sensitization. You can use social media as well to elicit responses, but perhaps, you know, engagement methods like community advisory boards or patient advisory groups are a bit more about engagement, where they're more tuned in towards listening to people's ideas, towards incorporating them in a way that improves research. So definitely some methods of engagement are much more suited to gathering people's inputs into research, certainly. It's a good question.
Thank you. Yeah, it's a really good one, because most of the people, I think, and we all are guilty in that sense, that we could be using social media just to convey instead of engaging. And that's something that we need to be switching on and actually take some leverage from, because it's a big platform that we could be using to actually engage with our communities and to promote our work, not only promote our work, but still engage. Thank you. I think with that question, we can wrap up the Q&A session with Dr. Davies. As I said before, we had multiple questions that could be directed and answered directly to you in the Q&A. So I entice Dr. Davies to go ahead with the questions that you can answer. So many thanks for this presentation. And then we're going to be moving to the second one. So in the meantime, Dr. Colomé, I'm going to be speaking about a little bit more about Dr. Colomé's background. So Dr. Manuel Colomé, he completed his Doctor of Medicine degree in the Autonomous University of Santo Domingo. He also obtained his PhD in epidemiology in public health from Rey Juan Carlos University in Spain. Additionally, he holds a master's degree in bioethics from the Santo Domingo Technological Institute, a master's degree in health science research, and another in microbiology and infectious diseases, both from the San Jorge University in Spain. Dr. Colomé has received various certifications in the field of epidemiology, hospital epidemiology, infection prevention and control, outbreak management, good clinical practices, and incident command systems and project managing. He also has held positions in responsibility in public health and consulted with international organizations such as the Pan American Health Organization, the Inter-American Development Bank, and the World Bank. He has served as an epidemiology coordinator for the National Health Service and currently manages the epidemiology service at Dr. Mendoza Pediatric Hospital. With extensive experience in surveillance, research, planning, and controlling infectious diseases in different settings, Dr. Colomé now directs the Health Research Institute at the Autonomous University of Santo Domingo. So the floor is open to you, Dr. Colomé.
Well, good morning. Thank you, Bryain, for the presentation. I'm gonna share my screen. Can you see?
Yes, we can see it.
Okay, so thank you everyone to assist to this webinar. It's my pleasure, it's an honor to collaborate with this network. So I'm gonna talk about ethics in health research. So this is my topic. This is a short agenda that what we will talking in this webinar. We're gonna talk about health research, artificial intelligence, and ethics and regulation. But focuses on bioethics. Well, in health research, you know, in health research is indispensable to solving public health challenges. Whatever, this is addressing the disease of poverty, responding to the rise of chronic disease, or ensuring mothers to have access to safe childbirth practice. These are some areas. You can see here some areas of health research. We can measure the distribution of and the magnitude of health problem. In the COVID-19, this is an example of how it's important the health research to understand the behavior of the disease, understand the causes of the determinant of the problem, whether due to biological, behavior, social, and environmental factors. Develop solutions or intervention to prevent or mitigate the problem. Implementation of delivery solutions through policies or health program, and finally, to evaluate the impact of this solution, because if we implement something, we need to measure to understand if this is possible or to get a good effect, okay? So health research, we have a gap. What is the gap? This is scientific knowledge is advancing too fast, okay? We develop and generate evidences every minute. But the problem is that research evidence is not too faster. It doesn't have a faster implementation in the clinical practice, for example. And what happened with that? But we need to understand the relation between practical evidence based. We have the clinical experience, the scientific evidence, and the patient values. So if we do health research, we need to implement this evidence and translate into the practice of the clinical practice, but using the best evidence possible and the patient values. And there is a need for new knowledge to be applied and translated into better health. And this is the gap. Today, society expects decisions to be based on the best available knowledge, but research initiatives are still not adequately organized or managed. This is when it enters the artificial intelligence. The artificial intelligence, a couple of years ago, we know the existence of ChatGPT. 546 million of people use ChatGPT in the world. The artificial intelligence is the ability of algorithm to encode the technological means to learn from data in order to perform automated tasks without a person explicitly programming or each step for process. And today we are talking about generative AI, for example, artificial intelligence, to create contents, to create solutions. But one of the ethical issues is where that AI is getting that information. What is the source of the algorithms? And we are going to talk about it in this presentation. The World Health Organization recognized that the artificial intelligence holds great promise for the practice of public health and medicine. The ethical issue that artificial intelligence entails for health system and service must be addressed. This is the application of the artificial intelligence to health. In medicine, we can right now we can improve diagnosis and treatment. In the health administration, we use the AI for assistance and logistics tasks. And public health using right now in surveillance. And what is the best example was in COVID-19 surveillance, for example, in health promotion and prevention. And in research, we in pharmacology, we develop drugs with precision medicine to get better health results or health outcomes. Understanding the problem, we have some implications and concerns. The implication is what I was mentioned, because there is a rushing adoption of improving system that could lead to errors by healthcare steps, cause harm to patients, erode the trust in AI, and thereby undermine or delay the potential long-term benefits uses for such technology worldwide. In the concern, we have biased data, wrong answers, data without consent. The post-truth, this is a concept what was very famous in the past 2 or 3 years, because today with the post-truth and the fake news, and if the AI use that information to develop the algorithm, we are not able to distinguish what is real or what is unreal, and we have some security. The ethics and regulation enter to this conversations because we have we need a moral ethics framework. Ethics is the ability of algorithm to encode in technological mean, right? The World Health Organization made these ethical principles. We have the autonomy first, so people have the ability to decide what they think that is better for his own life. People must be respected. People have to respect the values. Okay, in the benefit sense, we have the moral obligation to act in the benefits of the patient or the society or the community in general. We have to put away those PI feelings, the PI aims, and we have to embrace the community needs. Okay, so we have the equity, the in terms of justice. We need to all the benefits of the project. We need to think about how the project will be develop benefits in all the community, thinking in vulnerable groups, for example, in women's and children's, LGBT community, for example, and others. So in non-malefic sense, we have the prudence. We don't know, we can't cause harm to participant society. If you use the artificial intelligence or some resource solution in a project, this you don't have to harm. Okay, this is the framework of ethics, governance, and regulation of artificial intelligence from WHO. Tedros Adhanom, he's the director of World Health Organization. He said that AI holds a great promise to health, but also presents significant challenge, including unethical data collection, cybersecurity threats, and the rise of bias and misinformation. That's what we're all talking. This is the ethical principle in AI for health. We have autonomy, protect the human autonomy, to promote the responsibility and accountability, the well-being, to promote the welfare and safety of people in the public interest, ensure inclusivity and equity, transparency, ensuring transparency, clarity, and intelligibility, and sustainability to promote responsible and sustainable AI. So, in ethical challenge, what is the ethical challenge in health research with AI? We have the privacy and confidentiality, the use of sensitivity patient data and algorithms. You know, always we're having some misinformation. You know, the AI receive data from patients, for example, clinical history. So we need to act according to the local regulation. The fairness and algorithmic bias, algorithms trained with bias and discriminatory decisions. And this, we see this in the past at the beginning of the AI era. So if the programmer, if he developed an AI without this considering the equity, considering the respect of the dignity of the participant, the AI will act with discriminatory decisions. The interpretability and explainability. The lack of transparency in algorithms makes it difficult to understand decisions. So we need to adopt an open code. Responsibility and supervision, clear assignment of development responsibility. So what is the strategies to address the challenge? We have to implement in the research project and ethical design. This is when we start. The ethics in a project that started at the beginning at the planning phases. So integration of ethical principles from the beginning, the transparency, the disclose the bias and limitation of the promote accountability, the community participation to involve in decision making to ensure representation, But this community participation must be in the beginning of the study. So if we involve the community in the planning phase, in deciding the study, this will ensure a better health outcome for the community, because you trust, and the community trusts, that all the needs will be taken in count of the project. Finally, all projects must have an ethical evaluation. Institute review board must review the project according to the ethical principles. For example, the use of informed consent, the social value, scientific value, and respect for participants, taking care about the risk and benefits, etc. So my conclusions are that ethical principles include fundamental ethical principles and specific challenges in eye research. We should address the challenge, importance, addressing this ethical challenge to ensure integrity, equity, and safety in health research. There is a call to action to adopt robust ethical principle approach in development and implementing an eye for healthcare. Bill Gates, this is a quote: artificial intelligence will change everything. So thank you. You can email me, or if you have any question this is my ex Twitter account. Okay, so thank you again.
Thank you, Dr. Colomé, for this comprehensive topic, and thank you for delving into the ethics aspect of community engagement and applying them into artificial intelligence research and implementation. So we have a couple of questions. For the sake of time, we can only answer a couple or maybe three, in which they are really keen on knowing if there are any available artificial intelligence applications that can be used in public health research in general. That would be the first question.
Yes. Basically, we have the name. I don't remember the name exactly. It's that WHO software that he can do by himself the ethics review. Okay. So I'm gonna to search the name. I'm gonna put in the chat. But this software you can install, and you set in the protocol. Depending of how you answer some questions, check the software recommend if there is if the ethical IRB must review with all the members. Without or of it should be our expedited review. Okay. Yeah.
Amazing.
We have and we have a software is called EpiVigila, but it's not a smart software. EpiVigila is a software for public health surveillance. So if it review data and it make prediction of data, but it's not integrated chatbots that you can ask them. It doesn't have that function, but it is part of the software or application that we use in public health research.
Amazing, thank you. I think that's a great tool to have under our belts, having that guidance beforehand and before showing to institutional review board of ethics, and getting to know which is the aspect that we should be working on beforehand. It's a great comment, definitely given by this AI tool that you mentioned in the first comment. So thank you. We have another question. So the question is, sometimes non-maleficent it's not a question, rather than a comment, and maybe you can expand on it or elaborate. So sometimes non-maleficent is where medical personnel failed the most, not only basing it on direct physical damage, but they do not think about the physiological damage. What are your comments or thoughts on this statement? Thank you.
Thank you, Julio Salazar, for your question. Yes, always the people in the research they only try to, most of the cases, they are only try to talk about the physical damage, you know. But yeah, the psychological damage is a reality. And not only psychological, we have community damage. For example, in some communities, when the chief of the community decide for the population, this is not unethical. Yeah, this is unethical. So if we use that if we use that way to get the informed consent, it's not fair, you know, to get to do research in the community only with the permission of the chief of the community, okay, for the community leader. You have psychological damage. One of the example is that if there is something, for example, with that HIV research, that somebody give a permission to do research but it collect some sensible data or sensible information, that if the people expose his HIV condition, for example, so the participant will have a psychological damage, but not only a physical damage. This is an example of how we can integrate the informed consent and how we protect we must protect for non-maleficence. So in this case, if we have these information, these cases, in those cases, the informed consent should be taken for individually, okay, not only for the community leaders, individually. If the people have the ability to stop in any time of the project, to stop the decision and to be part of the study, okay. We must respect that and exclude this participant when it happens, or if he doesn't feel comfortable.
Amazing. Thank you. I think you shedding some light into the informed consent is something really important to talk about in the research aspect, and because we need to know, and we need to actually know how to convey this informed consent to the patient and be actually aware that the receiving end is actually understanding what are they going into beforehand. So it's really important to let them know and explain them specifically what are the aspects and the benefits and the risk and adverse events of taking the whatever medication or intervention in that sense. So it's really important. And I think it's a great segue into the next question or comment, which is how secure is the data from the patients if we use AI?
Well, we need to protect the data from the personal data for the patient. We, for example, we have to exclude the name and all the personal information that can conduct to reveal the participant role. We should protect the computer with passwords, and we have to control who can access to this data. For example, where I work in the hospital, we doesn't have the AI, the artificial intelligence implemented in all the hospital. We are doing baby steps, but we have a computer with software with personal access, so we can track the access for the doctors or the programmer, and then we can follow what he is doing with those data. So I think that is with control the access with passwords and some security specialists, that what we should include them, because in health research is not only for doctors or nurses. We have the translational research, so we should include engineers, economists, and everyone who can't be part of it and to get a better result.
Amazing, thank you. So that's a great advice. I think that's the biggest concern we in the medical field and in the general field as well. We have the biggest concern, which would be data security, and that's something that we need to be tailored and have some governance as well. And regarding governance, there's another question in the sense of, are you aware of any organizations or institutions who work towards developing AI policy in healthcare, specifically in the low and middle income countries? And they say that we are operating in an under-regulated environment, as we know, and we put our best efforts to maintain transparency and follow best practices, but seeking support in this area is important. What are your comments or thoughts? Thank you.
Yeah. Yes, I'm gonna share some links from WHO. We doesn't have well, this is involve local regulations, because
Mhm.
all the ethics and law regulation framework that WHO, this is only recommendations, you know. The final decision, it depends of the national government. But I'm part of a network, this I4PEC, this is artificial intelligence network, that in 3 months ago, in the past, we developed an initiative to describe how the states and the countries are using the artificial intelligence, what is about the ethics and regulation. We do a draft of paper. I'm gonna share the link when it has been published, but basically it depends of the WHO right now for this region. They have some frameworks and regulation, but they are only recommendation. This is there is another one. This is office for health research from WHO. This is new. They only have 1 year. And they made a call for expert this year in February to integrate expert in this office. So I'm gonna share the link to the participants to do more review about it.
Thank you, Dr. Colomé, for sharing those comprehensive resources as well. And as we know, the WHO is an institution that is going to be putting out guidelines, frameworks, and advices. But we need to actually take our research into the research uptake. So take it to the next step and see how we can regulate the policy. And then we should be identifying the stakeholders, in this sense, the policymakers, to actually attain that. So that's a great example of how we can use community engagement to propel our research efforts, specifically in this topic, AI. So I think we have time to answer another question. And this one would be, so far, there has been many AI developed to be implemented in the field level, or so far just in the use of ethical reviews and other epidemiological uses. So the question is it more like a reflection in the sense of the social science and the health research with the use of AI? So what are your thoughts? I'm going to repeat it again. So far, there has been I think there's a mistake here, because so far it has been any of the AI development to be implemented at the field level, or so far just in use of the ethical reviews. What other epidemiological uses of AI can you recommend? I think that's a question.
Yeah. Well, when I was in Colombia in 2017, they have an app called Guardianes por tu Salud, is Guardian for your health. Okay.
Mm-hmm.
In this app, the people it was in the context of Zika virus, so the people use the app to report the clinical symptoms. You know, because in Zika virus, 25% of the infected only get medical attention, so 75% doesn't know, so they stay at home, but Zika virus have a clinical outcomes. That is a microcephaly. The baby born with the head with a normal cephalic perimeter.
Circumference. Mm-hmm.
Yeah, circumference. So if a mother gets Zika virus, so there is a delay in the medical response to the mother. So they create this app to mothers to develop to monitoring the symptoms. Also, the app have information about the how to prevent the virus. This is an example how to prevent the virus, how to get medical assistance, etc. There is another example in Spain. They have the radar COVID-19. This radar use the Bluetooth function. If and the GPS and the people report if they are positive to COVID-19, for example, and if you enter to a supermarket, for example, and you are in a store or something like that, the app give you a warning that you are very close to people that are positive to COVID-19. But this app have some ethical issues because it share what your serological condition, okay? But this is an auto-report. So the people that use the app, they give the consent to inform that if they are positive to COVID-19. But I think the ethical issue is that it share the condition to the others that are near to the app. So there are some examples, okay? But you need to get a more ethical approach. In the other example, in the ethical reviews, we have this app, this website. I'm gonna to share the link in the future, but we doesn't have us right now. I don't remember a paper about this website, probably, or this app. Well, probably there is some of them.
Amazing, thank you. So the question was really about not the other uses of AI in the epidemiological field, but more into how can AI help or facilitate the role of social science during health research. What's your take on this?
Okay. Well, in this part, I think that the use of health research in social science should be it must take some considerations. For example, the community needs, it should take some language or anthropological variables and culture of the community. If we develop an AI without taking care about how the community communicate between them, between each other, if we don't use the same language or culture, probably the AI solution won't be effective, you know? For example, here in Dominican Republic, we speak Spanish, but it's not the same Spanish that Mexico or Panama. We have some words, especially for us, for culture. If I interact with a chat box using AI, I ask something, probably if depending of how this AI respond to me, probably I take care of this solution. Okay, so it will be more comfortable to me to read and listen a person, right? And I that speak like me, that talk like me, like a Dominican, and using my words, my culture, and my community. But this we need with them the anthropological and social psychologists to understand the community, and then to give to us, to the researcher, the outputs to develop a personalized AI solution.
Great answer. Thank you, Dr. Colome. I think this question, we can wrap that up, the Q&A for your session. Thank you for this comprehensive topic and discussing the ethics and how we can dive into the ethics specifically in AI. I encourage you to go to the Q&A chat box to answer many of the questions that were unresponsive because of the time constraints that we have, because we need to continue the agenda. But Dr. Colome is going to answer the couple of questions that we're missing regarding ethics and AI. So with this, I think we can continue to the next topic. Thank you, Dr. Colomé.
Thank you.
So then the next topic would be given by Luis Felipe Arias, and he is a clinical psychologist from the Dominican Republic as well. He has experience in research projects on mental health, violence prevention, and in the school setting. He has experience using digital tools to treat tuberculosis in the review of ethics and research done in the medical and the school settings as well. He has practical experience in working in the low-income psychiatric patients and their families as well, and in the community engagement with healthcare and their school personnel. Currently, he's part of the training and research unit at Éticos. He's interested in implementation of research ethics, and the formation and promotion of new researchers as well. So I welcome you, and I open the floor to Luis Felipe Arias, in which he's going to dive into the stakeholder mapping and analysis portion of this session. So the floor is open. Thank you.
Thank you, Bryain, for the presentation. Hello, all. It's good to be here. So my name is Luis Felipe Arias. I'm the regional coordinator of community engagement of the THA network here in Latin America and the Caribbean. I'm going to be talking to you about the stakeholder mapping and analysis. So to begin with, what is stakeholder mapping? So mapping stakeholders and bringing on board the most relevant actors at the start of the research study is the first step in the engagement process. This will ensure that your research questions are developed based on local priorities, context, and the needs of the study beneficiaries. This is a quote of a resource we're going to share at the end that talk about stakeholder mapping. So this is considering the stakeholders as people who influence what, how, and where research is done. The stakeholder mapping, identifying possible stakeholders, the priority to engage, and the best way to do so. And the community or community group, the people who are affected by the research and whether they take part in it or not. So, so we have the good participatory guidelines for clinical trials, which were originally developed for stakeholder engagement in HIV patients, then in TB patients, then emerging pathogens, and the COVID-19 trials. And this document highlights the importance of engaging stakeholders for a range of reasons. In this presentation, I'm going to talk about how to identify stakeholders which are relevant to studies and how to decide on appropriate ways of engaging them. So, having the range of stakeholders following the GPP, we have global stakeholders, national stakeholders, broader stakeholders, and community stakeholders, all around the trial participant. Over the next few slides, I'm going to describe the stakeholders, which were engaged for a multi-country study in COVID-19 in Africa and Latin America. So beginning with the global stakeholders, who were these stakeholders? They were research leaders and international press. Where were they engaged? For adapting research and plans to local context, advocacy, and public support. And the engagement methods were face-to-face meetings and online meetings, sharing policy briefs and animated videos. So which were the national stakeholders? The national stakeholders in this case were the Ministry of Health. Where were they engaged? For gaining public and institutional support, agreement on trial costs and benefits, and assessing trial acceptability. And the engagement methods being face-to-face meetings and online meetings, sharing policy briefs, animated videos, and PowerPoints. Now the broader stakeholders, they were the National Medical Association, National Nursing Association, national media, and radio, and non-NGOs. Where were they engaged? For advocacy and public and institutional support. The engagement methods was mostly informal, sharing policy briefs, animated videos, emails, letters, and some presentations. In the community stakeholders, we had the county health minister, the county and sub-county, health management teams, the hospital staff, community leaders, women's group, religious leaders, schools, and the community advisory board. Where were they engaged? For assessing the feasibility and acceptability of the project, for institutional support, input into implementation, raising awareness and addressing rumors, and for recruitment. The engagement methods being face-to-face meetings, town hall and community center meetings, and lab tours, regular community advisory board meetings, and recruitment posters. So, mapping. How stakeholders were identified. In this case, a research coordinator team was set up, comprising of the principal investigator, the engagement lead, communication lead, and social scientists. They go together in a brainstorming session, where they identify the range of stakeholders at the national, community, and broader levels. Each stakeholder's interest and influence in the proposed research was taken into account. So we have the stakeholder matrix. So in an ideal world, the research will be able to engage with all the stakeholders, but this is practically challenging. Because of this, the research team has to prioritize and see who to engage with and to what extent. For this is used the stakeholder matrix, which is a useful tool to map the stakeholders. So an effective use of this tool, it really depends on the research team's knowledge of the stakeholders and the community, and what are the priorities of the research, who is affected by it, and who can influence it. So the grid is divided into 4 zones, with the stakeholders that fall in the top right corner being the most important of all, the key players and partners, because they have the most influence and the highest interest. So in the opposite of that, the lowest priority is the stakeholders that have the lowest influence and the lowest interest of stakeholders. This doesn't mean that are outside of the scope of the engagement, but they have the lowest priority and the less time to engage, because the objective to engagement is normally to inform them. Then you have the stakeholders with the high influence but low interest, which are the stakeholders one seeks to involve. The stakeholders might have a lot of influence on the project, but low interest on it. We also have the stakeholders that have the highest interest in the project, but the lowest influence on it. These stakeholders we need to protect. These stakeholders have special attention. We have to put special attention to protect their interest. And normally they are the stakeholders that are affected by the research project, but don't have the influence to impact on it. So, considering a school-based trial exploring the impact of deworming and vitamin tablets on health and educational outcomes, we can see how the stakeholders will be fit in each of the three. For example, people in the neighboring districts might be the lowest priority because they have the lowest influence and the lowest interest on the research project. But being a school-based project, the district educational officer might be a stakeholder which has higher influence and highest interest on the project. So the stakeholders we need to maintain close and working in a working relationship with. This might be the case also for the parent-teacher groups. We have high influence and high interest also. Then we have the school principal, which also has a high interest and a high influence on the research projects. Now the students on the local university might have a low influence, a low interest on the research projects. The participant children, even though they have a low influence on this project, they have a high interest on it. So the stakeholders we need to protect. And the youth NGOs might have a high influence on the research project, but a low interest. So it's as stakeholders we need to engage and seek to involve in the project. So they pass to the key player grid of the matrix and have not only high influence, but high interest in the project. So with mapping, we see who to engage with and how much to engage them, taking into account the influence and the interest on the research project. Now for this, we're gonna have an activity. It will be your turn to map the stakeholders. Put in this example, a research group based in East Africa wants to conduct a research which to compare tumor diagnostics based on scans, interpreted by doctors against scans interpreted by AI. The research will be conducted in a large referral hospital. So in the chat, I would like to please suggest who might be important stakeholders to engage with for this research, and to assign their relative interest and influence. So you can start answering in the chat this activity, and Bryain and Sylvia will be reading them so that we categorize that categorized in the next grid.
Amazing. Thank you. So, well, we have the first participation now, and Anja, she says that the health department is a stakeholder we need to assess. Now, Anja, and well, yeah, they're having more participations, but they're not classifying them as high or low interest. So in that sense, I think Luis, I'm gonna read them out loud, and maybe you can place them in the area in which you think they could be either low or high interest and influence.
Yeah.
So the first participation we have the health department.
Department, okay. The Department of Health, you mean?
Mm-hmm. Yeah.
So there's something we need, but let me get to here. So the Department of Health might be a stakeholder that has a high influence and high interest on the research project.
Amazing. We have another participation by Dave. He's saying that the key player in this research study could be the patients.
Patients, all right, yes. So the patients normally are a group that has a high interest on the research project, but a low influence on it. It's a group we need to protect.
Interesting. We have another participation as well, and they're saying the health management team.
Okay. So let's say that in this case, so putting a challenge, because again, this change between research and context, they might have, for example, the management research, the management team might, normally they have high influence on the stake on the project. But what about if they have a low interest on it? So then we have a clear objective of engagement.
Amazing. So in this sense, we can, as we go and classify the stakeholders, you're suggesting or implying that we might have some disagreements within the team in which we could be classifying the stakeholders as a high influence and maybe a low interest, and others could classify them as the opposite. In that sense, we need to reach a consensus that is going to be very specific on the goals for the research. And that's something that the whole team needs to decide beforehand.
Exactly.
And we have another participation saying the community health promoters.
Perfect. So they might have a high interest and high influence on the project.
And that's something that we need to include at the beginning, because the health promoters, they are going to, as the name implies, they're going to promote the health outcomes of that have resulted from the research. And that's something that's really important for the community engagement, as they are really engaged and actually know the community. And that's something that we, maybe the researchers or maybe the medical team is not really that connected with our community, because we just tend to go towards just go and do the work and actually do not communicate as best as we could. And that's something that we need to address and change as well. And that's the main objective of this workshop, to actually enlighten or shed some light on that nuance. And they're saying as well, maybe we could consider the community leaders as well as part of the stakeholder. Community leaders.
They might. So in this case, let's say that the community leaders have a high influence but low interest on the research projects. Because right, the engagement hasn't begun. So is the community leaders one of the stakeholders to want to engage on the project?
In this regard, as you say, because at the beginning we could classify the stakeholder as, for example, this one, the community leaders, because high influence and a low interest, because the research has not begun yet. But is there a way that during the process of the research, the stakeholder could change of classification.
Yes, was
Or
you need to consider that in this matrix, the stakeholders are dynamic. You want the stakeholders to have high influence but low interest to have high interest also. So they pass to the matrix with it being a key player and partners. And
amazing. That's it.
you need to be careful of that the key players, you don't lose them and they don't pass to have low interest, for example. And it's something that change as the project go on. If you take, as Alun said, if you include the engagement process from the beginning through all the research project, you might be in a position where before beginning the project and having the idea, the community leaders might have low interest. But then when you get to the phase of implementation, they might have already high interest because they were involved in the planning, they were consulted on the feasibility, and when the implementation is beginning, let's say the trial itself, to see the diagnostic, they might have high interest, so they might be a key player at that point.
Amazing. That's a great input. Thank you. And the chat box, they're saying the NGOs. How we could classify the NGOs specifically for this research topic.
So for the school example, the NGO where high influence and high interest, you can say that if we start as an ally for an NGO, there might be also high interest and high influence on the project.
Interesting. But really, this underscores the need to classify the stakeholders. That really depends. The classification of the stakeholder depends on the research itself. So as you said before, it's something dynamic and it's something that could be changed along the research process, and it really depends on the goals of the research. Because sometimes that stakeholder is going to be of high influence, and depending on the type of research, and of course that could be the other case scenario in another type of research. So it really depends on which is the main goal of our research topic. So that's something we need to take into consideration. They're saying the patient's relatives.
So the patient's relative, they might be stakeholders with low influence but also low interest, which is in this just putting this scenario relative to a case where the investigation talk about a treatment, so then they might have a high interest, the relatives. But in this case, because only comparing two different diagnostic methods, the relatives might not be that interest. Maybe the patient go alone to the hospital, so the relatives don't know too much, don't have that interest on it. And in this case, it's a group that only needs to be informed. But again, being dynamic, that could change through the research process.
They're saying the ethics committee. How can we classify the ethics committee in this matrix?
So the ethics committee, in this case, the scenario, I feel like we could put it on the key players. Because the ethical implication that has this kind of research being conducted on the health center.
Amazing. So there's another participation, and I think it's really important for this research topic. What would you say about the radiologist? Because we're comparing the results from the AI conclusions versus the radiologist, so human versus artificial intelligence. Where could we classify the radiologist?
Well, in this case,
or doctors in this case as well.
Yeah. So in this case, here is a point where in the brainstorming session we could debate on it. For a point, they could say they have high interest on the project because of what you say, but maybe low influence. It will be argued if they are the implementators, then they have a high influence on the research projects.
Makes sense.
At the end of the day, they are the conducting the project. So I feel like So it could even be put in the middle. Maybe you decide it's a key player. Maybe you decide it's a stakeholder that have a high interest but not high influence. But here we see the dynamic part of it. How it could go either way, according to the context of the research and how the research is done.
Amazing. I think it's great to see this like dynamism happening in front of our eyes, because this opens up to the idea that the stakeholders are dynamic, as you said before. So we need to have that into consideration. They're saying the national government. In this case, how could we classify the national government in the matrix?
So in this case, we could have the national government having so this is also a case-to-case basis. There are countries where the national government has a high influence, even though it's something you do with the Department of Health. In other cases, the Department of Health has certain autonomy, so the national government will be only a stakeholder that has a low interest or low influence, and is a stakeholder you want to inform, but not that much to engage with. But you don't have the energy.
Amazing. So I think a lot of the participations from the attendees are summarized in the screen right now. So I think I can leave it up to you if you want to add any others regarding this specific research topic, or maybe Dr. Alun Davies can chip in some comments in which you could regard or classify other stakeholders that are not in the screen right now, and how we could classify them.
So just for the sake of the sample, I would like to add, for example, the school director being a stakeholder that has a key player in the last example, but in this example, because his health base is in a hospital, it might be a stakeholder that has a low interest and low influence on it. So you might know that even if you go and see a guy and see which stakeholder you need to engage, they don't always have the same priority and influence for your project than the project that was taken as an example.
Amazing. So there's another participation saying, maybe what about the students, the medical students, or any other type of students? Because as we know, we usually conduct research in this big university-based hospital programs. So in that sense, we are going to be encountering students along the research process. Maybe they could be of help. Maybe they're going to be the participants or the actual on the receiver end. So where will you classify the students in the matrix?
So as you say, it depends of are the students the participants, not as you say, only observers. They are taken as an implementator of the hospital. Maybe it's a teaching hospital, so most of the radiologists are also students in radiology.
Yeah, exactly. Yeah,
It definitely will depend.
it really depends on the if the students being part of the research or of the researcher team as well, as you said. Thank you. So we have other participations like
Bryain, can I
PIs? Yeah, sure. Go ahead.
I think this is really great. Louis brought out quite a lot of interesting points there, and the audience has brought out a lot of different stakeholders. I guess what this really points out to me is a few things, actually, that it really, really depends on the context where you work. So, for example, in some countries, in some hospitals, some people like a radiologist might be a really influential and important person to engage with, whereas in other contexts and countries and hospitals, they might not be. So that really highlights the point that it's really important to have groups within those areas to brainstorm, who are the stakeholders, first of all, to list them all. And as you see, there's a lot there. There's a lot of stakeholders that you can engage with. And as Louis said earlier, it's physically impossible. You just don't have the budget and the time to engage with everyone. So you have to make decisions often of who do you prioritize. So it's really important that it's really important that groups who are working in this area come together to brainstorm who are the important stakeholders to prioritize their engagement, and how best what they should engage. And this map has really shown how that's really important, because people might start to have different ideas of who should be placed where. So that's really great. That's really great, Luis. Brilliant stuff. Thanks.
Thanks. Definitely, I agree with Dr. Al.
I would like to
Go
add
ahead.
on a concrete example of a case on a TB study using an app for treatment for TB patients being video observed, right, and direct observed, so the patient doesn't have to go to the clinics. We see, for example, you might say, well, the community health promoters are a key player in this. They have a high influence and high interest, and normally are the ones that are follow the treatment of TB for the patients. But then we see when we go to the field and start implementing, which is the reality, that the community health promoters have a high interest but low influence on the project, because culturally and professionally, particularly in this case, in the DR, they don't do anything without the approval of the medic in charge of the TB units.
Mm-hmm.
So in that case, it's a stakeholder that you need to have their interest into account, and their needs, but also the key partners in this case has to be the doctor that is the head of the TB department in that case, and this is the stakeholder you need to engage. And maybe that way, make the community health promoters have a high influence by having them with you and the medical doctor to give them the authority and responsibility of that they can participate in the project freely with approval.
Amazing. Thank you, Luis Felipe Arias, for this comprehensive and this interactive session as well. Thank you for the audience for participating as well. This has been really enlightening as we were discussing it, and it makes a difference definitely having this into consideration. So I'm gonna go over a couple of questions because we have the time to go through them. So these questions will be open to you, Luis Felipe, or to you, Dr. Alun Davies, if you want to answer them. So the first question is asked by Mary. She's saying, as a researcher, how do you justify your list of the stakeholders before the analysis? The floor is open.
I think what's really important to do is that this is not just a job for one person. This is definitely a team, a team exercise. And I think if you include people within, let's say the research is taking place in the hospital, ideally you'd include partners in the hospital in that brainstorming of list of people who you engage and who you count as stakeholders. So perhaps the answer to that question is not the actual finite list it's about the process. What's the appropriate process, and who do you include in that process of identifying stakeholders and apportioning relative values of influence and interest in the study. So it's about group work, I think, and brainstorming as a team.
Amazing. I think that's the common denominator, common goal, to have this whole team organized and to make the decision-making process as a whole, because the whole researcher team has to be weighed in the participations and any decisions that may come ahead of the research work. Luis Felipe, you were going to say something.
Yeah, that, as Alun said, it's a group work. Like, you include in the brainstorming session, you include the PI, you include the community engagement officer, you include maybe a sociologist of some kind.
Mhm.
You have to pull different people that have different perspectives to see who the stakeholders are. Because for example, let's say the PI has the most knowledge and of the objective of the research project, for example. But even having that scope, you might not see, for example, the perspective of the engagement officer who goes normally in the field. For example, they might have experience engaging with health workers. So he will tell you in these settings who are the one that have to, the stakeholder that you have to take into account. And that's why even then, when you decide, everyone gets together and decide which stakeholders are to take into account, maybe through the research project, you see that there are some that you didn't take into account that should be in the engagement plan.
Amazing. I think this is a great segue into the next question, which is who are needed to be involved when making the stakeholder mapping, and how we can decide if we already cover all the stakeholders, and how long do usually we develop the stakeholder mapping technique. The floor is open.
So definitely everyone that can and the research group should be involved for the sake of them having different perspectives. And with the stakeholders, it's a tricky question of how long should be the time we should invest on it, and how and when do we decide, okay, we're done, we have everyone. In that case, it should be taken into account maybe the resources you have and how do you look and have a general knowledge of the field you're gonna get into. It's the health research, it's a school research. You know, that's why we also encourage that doing the research, even after the research, you stay in contact with the stakeholders because you're definitely gonna need them later. And it's a subject for another version maybe. There's a way of stakeholder mapping that is active, that the same stakeholders you work with are the one that help you in the stakeholder mapping. You know, they're in the community. They know which are the influential persons and organizations, because a lot of times you get to a new community in a research project and you don't know which NGO there are over there, you know, which organizations. You might know that there's some government officers, but you don't know what about if one is particular more keen to the community than the other, you know, being involved. So there's a lot of stuff that why it's important to have an eye in the community as long as you can, to have a hearing, so that when you engage with them, you know who to talk to and who to guide you into the stakeholder priority, and how much is how much ground can you realistically cover with your resources that you have available.
Amazing. Thank you. Thank you for answering. And I think we have time to answer another question, which is of key importance, I think. So what is the best way to declare the stakeholder interest and the influence level? And how do you reconcile this?
So the best way will be the engagement, because again, it's dynamic, right? So at the first, you have only a outside idea of how interested and how influenced they might be. And then through the engagement, informing them, having wide engagement, then deep with their conversation, you can gauge their interest and influence. Normally the influence at the beginning, you might see because let's say your knowledge of the organization, for example, you know, the health ministry, or you know, as a regulator, they might have a high influence on the research project. Of course, the leaders and the research hospital, but then the interest, that is something that through the engagement you start to gauge, to see. You might think, well, the health minister, of course, gonna have high interest on this project. And you engage with them, and you see is the opposite, right? That maybe not respond to the letter, to your meetings. So now you know your engagement strategy has to have into account to have them to get more interest from them, you know. And also, for example, the community health personnel, for example, maybe engaging with them, you see that they like the project, that they have an interest, that they also see that it's a problem that needs to be resolved. So you see, well, they have a high interest now. And depend on on how participatory they are in the research project, you might gauge their influence on it.
Amazing. Thank you. I think with this question, we can wrap up the Q&A section of your presentation, Felipe. Thank you again, Felipe and Dr. Alun Davies, for making this interactive session. And thank you as well for the audience for participating as well. So so this will be the end, and this will be the wrap of the first day of our workshop. I think we can reflect on it, and then we have many valuable discussions given by the professionals and really well-experienced speakers. So for a recap, we started the comprehensive review of community engagement, the global health research given by Dr. Alun Davies. And this session underscored the importance of involving communities in health initiatives and to ensure the interventions are relevant, acceptable, and sustainable. Then we delved into the ethics of health research, specifically AI research. So the discussion highlighted the critical need for ethical considerations to look for guidance and frameworks in order to ensure that AI applications in health are used responsibly and equitable as well. And finally, thank you for interactive session that was given by Felipe on the stakeholder mapping and analysis, which provided a practical tool such as a matrix and the strategies for identifying and engaging with the key stakeholders. And as we know, this is something imperative and is going to be essential as we move forward with our projects, specifically in research. So I want to extend my deepest thanks to the speakers and the panelists for sharing their expertise, and to all of you for the participation, for your active participation and insightful contributions as well during the interactive session. And we look ahead to the next session, the second occurrence of the workshop that will happen on the next Tuesday, May 28th, at the same time and channel, and in which we will be discussing, and it's going to be more focused on the strategies for effectively communicating the results of the research. And this communication is going to be given, or it's going to be tailored for the stakeholders in the community, of course. And we will also be delving into the real case scenario series of AI projects and their challenges and their solutions regarding the community engagement strategy that they are undertaking as well. So I encourage you all to come and to prepare to engage and collaborate further with this initiative as well. So thank you again for your dedication and for making time for this session today, and have a great evening as well. And as for the certifications, I can reiterate that if you wish to have this certification of attendance, you can do so by doing these two requirements. So the first one would be the completion of the TGHN workshop feedback survey that is going to be sent to you via email. And secondly, you need to have an 80% attendance of the workshop session, so the two occurrences. So in order for you to have the certificate, you need to include the event's title, which is Empowering Communities, Innovative Approaches to AI Health Research and Engagement, and the code. You can screenshot this image. So you need to input that code 210524, and it's going to be requested to you in the form. And the certificate will automatically be sent to you within a month. You can scan the QR code, or you can go into that link as well to have further assistance in this. So many thanks for attending, and we will see you the next occurrence, which is on the next Tuesday, as I said earlier. Many thanks.